Look at the far end of the room right now. Pick a word on a label, a clock, any text at distance. Can you read it clearly, or does it feel just a little soft, a little blurry around the edges? If you had any hesitation at all, stay with me. Because what I'm about to show you has nothing to do with your glasses prescription, nothing to do with age-related changes in the retina, and nothing to do with your genetics. 7 days from now, people who follow this exact protocol report something remarkable. They describe it as the fog lifted. Text they were squinting at across the room suddenly snaps into focus. Colors feel more vivid. The dull pressure behind the eyes, that constant low-grade fatigue after screen time, it fades. That is the result. A complete 6-step protocol: massage, movement, neural activation that takes about 15 minutes a day. But here's the contrast I need you to sit with for a moment. Right now, the most common response when vision starts to blur is get stronger glasses, update the prescription, maybe consider surgery one day. No, that's not wrong, but it is profoundly incomplete because the root cause in a large percentage of people over 50 is not inside the eye itself. I'll explain everything in this video, but there is one critical detail, one thing most people do completely backwards, and if you miss it, the rest of this protocol will give you maybe 30% of the results it should. I'm going to reveal exactly what that is before we finish today, so stay all the way through. Let's begin. Your eyes are not an isolated system. Behind your skull, 2 vertebral arteries pass directly through small channels in the bones of your cervical spine. These arteries supply blood to the visual cortex, the brainstem, and the pathways of the optic nerve. Now, when the muscles of the neck, especially the deep suboccipital group, those 4 small muscles sitting right at the base of your skull, when they enter chronic spasm, they compress the surrounding structures. Blood flow slows. Neural signals traveling between the cervical ganglia and the eye muscles become sluggish. The result? Your visual system receives less fuel and less information than it needs to function clearly. And here is what makes this particularly frustrating. These muscles almost never hurt. You will not feel the tension until you begin working it out. But the effects, reduced sharpness, tired sensations behind the eyes, difficulty adjusting focus between distances, those you feel every single day. So let's start with an assessment. Before you do anything else, check in with your neck. Sit upright. Drop your chin slightly toward your chest, not all the way down, just a gentle tilt. Now, slowly rotate your head to the right, about 20 degrees. Stop there. Notice anything? A pull, a catch, a sense that the muscles are reluctant to move? That resistance is tension, and tension means restriction. Return to center, then rotate left. Again, gentle range. Take note of which side feels tighter. That side is almost certainly contributing more to whatever visual symptoms you're experiencing. You don't need to fix anything right now. Just notice. Awareness is the first step in releasing something you didn't even know you were holding. 90% of the people who do this check for the first time are genuinely surprised. They thought their neck was fine. It wasn't. Now we move to the technique that creates the most immediate change. At the base of your skull, where bone meets the top of the spine, there is a dense cluster of muscles, nerves, and connective tissue called the suboccipital triangle. It is, in my clinical experience, one of the most chronically neglected areas in the entire human body. When these muscles are tight, they don't just restrict mechanical movement. They compress the lesser and greater occipital nerves, both of which have pathways that influence sensory processing around the eye and the forehead. They also reduce lymphatic drainage from the head, which creates that heavy, pressured sensation so many patients describe to me. Release this area and nutrients flow. Waste products drain. The cranial nerves have room to breathe. Here is the technique. Place both hands behind your head. Find the ridge of bone at the base of your skull. That is the occipital ridge. With both thumbs, or 2 fingers if that is more comfortable, press gently into the soft tissue just below that ridge. You are not pressing on the bone itself. You are pressing into the tissue underneath it. Hold that pressure. Breathe slowly. Let the tissue soften. Now make small, slow, circular movements. About 1 full circle every 4 seconds. Work from the center outward toward your ears. You will find spots that feel dense, ropey, or tender. Those are precisely the spots that need this attention. Spend at least 90 seconds on each side. When you hit a tender point, don't pull away. Maintain gentle pressure and breathe through it. Within about 20 to 30 seconds, you will feel the tissue begin to release. That release is circulation returning. One of my patients, a 63-year-old retired teacher, came to me describing what she called watercolor vision, like everything was slightly washed out and soft. She had visited 3 eye specialists over 2 years. 2 weeks after starting this massage consistently, she sent me a message. I can read the license plates on the street again. The face tells a story most people never think to read. The muscles of the forehead, brow, and temporal region are in a state of near constant low-grade contraction in most adults. Frowning at screens, squinting against bright light, holding focused concentration for hours. Over years, this creates fascial restriction, a gradual tightening of the connective tissue that wraps around the muscles and skull. And here is the anatomical key. The fascia of the scalp is directly continuous with the fascia over the eye socket. Tension in your forehead can physically restrict the mobility of tissue around your eyes. The veil sensation, that feeling that something gauzy is hanging between you and the world, is often this. Not an optical problem, a mechanical one. Let me show you how to address it. Place the flat pads of your fingers across your forehead, just above the eyebrows. Now press very lightly upward toward the hairline and hold. You are not rubbing. You are creating gentle traction, asking the tissue to lengthen. Hold for 10 seconds. Release slowly. Repeat 3 times. Now move to the temples. The temporalis muscle, a broad fan-shaped muscle on each side of the head, is almost universally tight in people who spend time at desks or screens. Place 2 or 3 fingers on your temples. Apply gentle pressure. Make slow circular motions. You are not working hard here. This is subtle tissue work. The effort level should be about 2 out of 10. After 60 seconds on each temple, most people notice their eyes feel physically lighter, less heavy, less pressured. That is not a placebo effect. That is circulation returning to tissue that was compressed. There is a reason ancient traditions, from Ayurvedic medicine to traditional Chinese practice, place such emphasis on head and face work. They understood something modern medicine is only now quantifying. The head is not separate from the body. Your eyes are moved by 6 external muscles, the oculomotor group, and surrounded by a ring of connective tissue holding them in the orbital socket. These muscles, like all muscles, accumulate tension, particularly after hours of focusing at a fixed distance, which is exactly what reading and screen use demand of them, for hours, every day, for years. When these muscles are chronically contracted, 3 things happen. The blood supply to the outer layers of the eye is reduced. The lymphatic circulation around the orbit slows, creating that puffy, tired appearance. And the feedback loop between the eye muscles and the brain becomes noisy, which contributes to the difficulty many people have shifting focus quickly. Close your eyes. With your ring fingers, specifically ring fingers because they naturally apply the lightest pressure, gently rest them on your closed eyelids. Apply no pressure, just the weight of the fingers resting there. Breathe slowly. After 20 seconds, make the gentlest possible circular movements, the slowest you can manage, as if moving through warm water. Continue for 60 seconds. Now move to the bony ridge surrounding the eye socket, the orbital rim. Using both ring fingers, trace slowly along the upper rim, then below the eye, then up the side closest to the nose. You are not pressing on the eyeball at any point. You are working the tissue around it. This movement stimulates local circulation, encourages lymphatic drainage, and sends a relaxation signal through the trigeminal nerve directly into the brainstem. After 2 minutes, the area around your eyes should feel noticeably warmer and more relaxed. We are now at the midpoint of the protocol. This is the moment to close your eyes and take 3 full, slow breaths. Not for spiritual reasons, for physiological ones. Slow, deep breathing activates the parasympathetic nervous system, and when the nervous system shifts out of sympathetic activation, muscle tissue, including the muscles of the neck, face, and eyes, releases its baseline tension automatically. You have done significant work in the last several minutes. Let your nervous system integrate it before we continue. This next technique is one that surprises almost everyone. The tongue is not just a tool for speaking and eating. It is a dense bundle of muscular tissue that shares neurological territory with some of the most important cranial nerves involved in visual processing. Tongue movements activate the hypoglossal nerve, which connects through the brainstem to the cranial nerves controlling eye movement, the oculomotor, trochlear, and abducens nerves. There is also a direct anatomical relationship between the muscles at the base of the tongue and the deep cervical flexors, the muscles that govern precise alignment of the upper cervical spine. When you combine tongue movement with a fixed visual gaze, you create simultaneous demand on two neurological systems that rarely work together consciously. This activates what neuroscientists call cross-modal plasticity, the brain's ability to strengthen neural pathways through coordinated, novel stimulus. Here is what to do. Pick a fixed point on the wall in front of you. A small mark, the corner of a picture frame, any small distinct target at about eye level. Fix your gaze on that point. Don't let it wander. Now, while holding that gaze perfectly still, begin moving your tongue. Press the tip of your tongue slowly to the right side of your mouth. Hold 2 seconds. Return to center. Hold 2 seconds. Then to the left. Hold 2 seconds. Keep your eyes absolutely fixed throughout. Then press your tongue firmly against the roof of your mouth. Hold 2 seconds. Release. Then push your tongue against the back of your lower front teeth. Hold 2 seconds. Release. Repeat the full sequence. Right, center, left, roof, front. 5 times. This takes about 90 seconds, and I want to be honest with you, it feels strange. But strange is exactly the point. Novelty creates neuroplasticity. You are building new connections between your movement system and your visual system, and the brain responds to exactly this kind of challenge. A 2022 study from the University of Auckland found that cross-modal sensory motor training, combining eye fixation with non-visual muscle activation, improved visual processing speed in adults over 60 by an average of 14% after just 4 weeks. The brain gets better at what you consistently ask it to do. And now we arrive at the most direct training for the eye itself. Inside the eye, wrapped around the lens, is a ring of smooth muscle called the ciliary muscle. This muscle has one function, to change the shape of the lens. When you look at something close, it contracts, thickening the lens. When you look far away, it relaxes, allowing the lens to flatten. The problem for most adults today is that this muscle is chronically contracted. We spend the majority of our waking hours looking at screens, books, and phones, all at distances of less than 1 meter. The ciliary muscle never fully relaxes. Over years, this chronic contraction reduces the muscle's range of motion, and when you suddenly need to see something far away clearly, the muscle cannot release quickly enough. This is called accommodative fatigue, and it is extraordinarily common in people over 50. The good news, like any muscle, the ciliary muscle responds to targeted training. For this exercise, you need 2 reference points. Hold one finger up in front of your face, about 30 centimeters away. That is your near target. Choose a far target, something at least 6 meters away. The far end of the room, a tree outside the window, anything distant and distinct. Now, slowly shift your focus from your finger to the far target. The word slowly is critical. Most people rush this exercise, flicking between near and far. That defeats the purpose entirely. Take 3 full seconds to shift focus from near to far. Allow the image to become genuinely clear. Hold it for 2 seconds at the far target. Then, 3 full seconds to shift back to your finger. Allow it to come into clear focus. Hold for 2 seconds. Repeat this cycle 10 times. If you do this correctly, you will feel a mild fatigue in the eyes after about 7 or 8 cycles. That is the ciliary muscle being asked to work through its full range of motion, possibly for the first time in months. That is exactly what we are looking for. There is a concept in rehabilitative medicine called the training effect. Any tissue, muscle, tendon, bone, neural pathway, adapts to the demands placed on it. Your eye muscles have been operating in one narrow range for years. You are now asking them to work differently. The adaptation takes time, but it begins in the very first session. Now I need to tell you something important, something I promised at the beginning. because this is the part most people get completely wrong. For roughly half of the people watching this, the protocol I just described will give them less than half the results it should. Not because the techniques don't work, they do. I have used them clinically for over 2 decades, but because of one very specific error in how people apply them. The mistake is pressure. When people feel tension in the neck or around the eyes, the instinct is to press hard, to dig in, to force the release. No, that is exactly backwards. When you press too hard, the muscle's protective reflex activates. The tissue contracts further. You create local inflammation, and you finish the session with a headache and less mobility than when you started. This entire protocol operates on light touch, the kind of pressure where you feel like you're barely doing anything. That restraint is not weakness, it is precision. The tissue needs permission to release. It cannot be forced open. This is the critical detail I mentioned at the beginning. The reason this protocol fails for people isn't the exercises, it's the application. Too much force, too much speed, too much effort in exactly the places that require gentleness. Second common mistake, breaking the sequence. The 6 steps in this protocol are ordered deliberately. You begin with the neck to improve circulation. You move to the face to free the fascial layer. You work the eye muscles only after the surrounding tissue is already relaxed. You activate neural pathways after the muscles are prepared. Skip ahead to the middle, and you are building on a foundation that isn't ready. Third mistake, doing this once or twice and stopping. I see this constantly. People do the protocol, feel a noticeable difference, assume they're fixed, and stop. The cervical muscles didn't tighten in a week. They tightened over years. The ciliary muscle didn't lose its range overnight. Real lasting change requires consistency. 15 minutes every single day for a minimum of 3 weeks. After 3 weeks, most people have established enough lasting change in the tissue that maintenance requires only 4 or 5 sessions per week. But the first 3 weeks are non-negotiable. And there is one more element that connects everything: the spine itself. Everything I showed you today addresses the cervical region, but the cervical spine is only as healthy as the spine below it. Thoracic rigidity pulls the neck forward. Lumbar imbalance changes the entire postural chain, putting strain on structures that shouldn't be carrying it. If you are genuinely serious about your vision, you are also serious about your posture, about how you sit for hours at a time, about the mobility of your mid-back. I covered exactly this in another video, the specific thoracic habits that quietly ruin cervical mobility and, through it, your visual clarity. The link will be in the description below. Let me leave you with the full protocol, clean and simple. Step 1, neck awareness. Check both sides, note the tighter side. Step 2, suboccipital massage, 90 seconds each side. Gentle circular pressure below the occipital ridge. Step 3, forehead traction and temple release, 1 minute each side, effort level 2 out of 10. Step 4, orbital and eye muscle work, 2 minutes, ring fingers only, no pressure on the eyeball. Step 5, tongue and gaze activation, 5 full sequences, eyes fixed, tongue moving through all positions. Step 6, ciliary muscle training, 10 slow cycles, 3 full seconds each direction, near to far and back. 15 minutes every day. Now, I am genuinely curious about something, and I ask this because it shapes every video I make. Which of these 6 steps surprised you the most? The tongue exercise? The connection between neck tension and vision? Something else? Write it in the comments, honestly, because the patterns in what surprises people tell me exactly what to focus on next. Take care of your spine. Take care of your eyes. I will see you in the next video.